How? Pilame ayelo, mitakuyepi. Hello, thank you, and welcome to all my relations who are here today. I'm very honored to be a part of these important discussions. And I want to start by acknowledging the First Lady and the Governor for having the courage to take this on in a very open and meaningful way. So let's give them another applause. I also want to thank Joseph. What a courageous young man to be out here and bearing his soul to us in such a meaningful way. And he makes me very proud as a fellow Oglala Lakota. Well, I'm going to be talking about holistic and cultural approaches to recovery, recognizing that each person is different. People experience addiction differently. They experience recovery differently. But also populations have different histories, different cultures, and different approaches to addiction and recovery. So I'm going to be talking primarily from the American Indian perspective here in the Northern Plains. I like this map a lot. It shows where North Dakota, South Dakota, and Minnesota are currently located, but also the homelands of my ancestors. So we call ourselves the Oyate, or the people, and there's Lakota, Dakota, and Nakota. Lakotas historically were in what is now western South Dakota. Dakotas were in the eastern part of the state, but also into Minnesota, and the Nakotas were to the south. So for some reason, it's a little known fact, but the reason this is North Dakota is that the colonizers came from the east, so they encountered the Dakotas first. So that's why it became the Dakota Territory. If they had come from the other direction, we'd be in North Lakota. So I'd be on faculty at UNL instead of UND, right? So when I think about the region where we are, and one of the reasons why it's so important for me to be here, when I think about even Grand Forks, what is the name of that city and why is it called Grand Forks? Well, it is the forks of the Red Lake River coming west and the Red River heading north. And it was a gathering point. It was a sacred site. It was where people would gather in the summertime for various types of ceremonies and meetings and gatherings. And you could take a canoe from Red Lake, Minnesota to Lake Winnipeg in what is now Canada. And then heading north from here at the Forks, for those of you who have been to Winnipeg, you know the Forks. That's where the Assiniboine River meets the Red River before it drains into Lake Winnipeg. And that's where we had our 7 council fires, where the 7 bands of the Oyate would come together every summer. And again, this is a very sacred place where we are, this Red River Valley. And again, it's North Dakota and South Dakota. That's a tribe. And just by a quick show of hands, how many people know what the word Minnesota means? Very, very few people. A couple people know what the word Minnesota means. Well, it actually comes from a Dakota term. Mani is water. You may have heard of Mani Wichoni. So Mani is water, and Shota is like smoke or a cloud. It's a descriptive term. So we've all seen in this area when the smoke is rising off of the water, that is a Mani Shota. So this is Minnesota, right? A Mani Shota. So just across the river, that's what it is. So it's a descriptive term. The land of the Mani Shota was Dakota. Now, what's interesting, we've all heard of Minneapolis, right? How many of you knew that you were speaking bilingually when you said Minneapolis? Mani is Dakota, and polis is Greek for city, right? So you're speaking Dakota Greek every time you say Minneapolis. Well, I'm originally from Kyle, South Dakota, on the Pine Ridge Indian Reservation. The original name of Kyle is Prejuta Haka, which means medicine root. And I'm very fortunate to come from a family with a lot of medicine men and traditional healers. And in this region, we still have a lot of our traditional healers in modern times, and many of them are my uncles that I'm related to. So from Kyle, South Dakota, that really is one of the areas where we still have strong connectivity to culture, and we understand our history in a very meaningful way. One of my ancestors was Chief Stabber, and this is a picture of him from 1872. He was part of what was called the Sioux delegation of tribal leaders that went to Washington, D.C. So I always like to say that health policy and advocacy is in my blood, quite literally. So Chief Stabber had a son named Crandall Stabber. Crandall's son was Louis Stabber, and Louis's daughter was my mom, Beverly. And this is a picture of Louis Stabber and his wife, Eva. And that's some big baby that Louis is holding there in the 1960s, who shall remain nameless at the moment. But I was given my grandfather's name, Prejuta Wichasha, which means medicine man in Lakota. So Prejuta is medicine and Wichasha means man. And I was named after my grandfather, and he was a traditional healer. So I'm just very fortunate and blessed to come from a family with strong cultural roots and strong cultural connectedness. But we've seen dramatic changes since the time of my great-grandfather, Chief Stabber, haven't we? Tremendous changes that have been occurring in the US and certainly for indigenous populations. So in our traditional way, we did not have a written language. So we learn about culture, we learn our life lessons through stories. And there is a story of three sisters walking along a river. And as they're walking along the river, they see babies and young children in the water struggling to stay afloat. So the first sister jumps in and says, this is an emergency, it's a crisis, we need to get the babies out of the water right now. The second sister says, no, we need to teach them how to swim so they can survive while they're in the water. And the third sister keeps walking upstream, and the other two get mad at her and say, where are you going? Why aren't you helping us? And she says, I'm going to find out who's putting these babies in the water, and I'm going to stop them. That's public health. That's literally working further upstream. And when I think about challenges with addiction, do we need crisis management? Absolutely. Do we need long-term treatment and therapy to promote recovery? Absolutely. But we also need prevention. And when I think about challenges related to addiction in my population and in other populations that are historically marginalized, we have a lot of unresolved trauma. And the downstream effects and the intergenerational effects of unresolved trauma results in things like self-medication. I see a lot of people who are self-medicating unresolved trauma, whether it's alcohol, other drugs or substances, or even food, right? People are self-medicating unresolved trauma. So we need to think of this in a much more holistic way. And as we think about recovery reinvented, we have to recognize there is a continuum. Of course we need crisis management, and of course we need long-term recovery programs. But as a society, we need to create the social conditions in which people do not feel marginalized, right? It feels like I'm saying 1 + 1 = 2, but we're not there yet, are we, in terms of promoting health? So when I talk about our traditional ways, I always like to start with a brief history of medicine. So very brief history. 2000 BC, here eat this root. 1000 AD, that root is heathen, here say this prayer. 1800, that prayer is superstition, here drink this potion. 1900, that potion is snake oil, here swallow this pill. 1950, that pill is ineffective, here take this antibiotic. And year 2000, that antibiotic is artificial, here eat this root. So we've kind of come full circle, haven't we? I always like to joke, getting back to the roots of medicine. I know it's a bad pun, I apologize. You know what's fascinating? When we think about the advances in scientific medicine, one of the biggest accomplishments is the discovery and use of antibiotics. So we can now cure infectious disease that historically could be deadly. So it was kind of seen almost as a miracle. But in truth, the original antibiotics are naturopathic medicine. So for millennia, fungus and mold and bacteria had created chemicals to kill each other because they were competing for space and for food. So the original antibiotics, like penicillin, is from penicillium, which is a mold, and streptomycin is from streptomyces, another mold. So I always like to point out that our biggest scientific advance in modern medicine over the last century is that we finally harnessed the healing power of mold. Makes me wonder what mildew might have to offer us. Well, when I think about the differences between traditional Lakota medicine and modern allopathic medicine, I put a lot of time and thought into this. And I went through medical school and residency knowing that I was becoming an allopathic physician. And I knew allopathic doctor. But I never knew what that word meant until I was done with my training. I actually looked it up. So allopathic actually comes from two Greek words. Allos, meaning opposite or other, and pathos, meaning disease or suffering. So pathology is the study of disease. In allopathic medicine, we're trying to produce the opposite effect of the symptom or the disease that we are treating. So that's why so many of our medications are anti-something, antibiotics, antihypertensives, antidepressants. Or they're blockers, like beta blockers, calcium channel blockers. or they're lytics, meaning to lyse or kill. So anxiolytics, thrombolytics. So we're really at war, aren't we, in modern scientific medicine? Get your diagnosis, get your anti, and just beat the heck out of it. Is it possible that could cause side effects? Is it possible that there could be unintended consequences if we only have an allopathic approach? Well, in the traditional way, we don't focus just on the disease process. We look at things much more holistically. And the first thing I noticed about that word is that it's not holopathic. We're not just talking about disease. It's really interesting in modern medicine, we define people quite often by their disease process. Over the years, I've heard things like the diabetic in room 6, the heart patient on the 3rd floor, the drug addict, the alcoholic. Is that how we should be defining human beings? People, fellow human beings. And it is remarkable to me that we tend to do that in the modern medical approach. I see things changing for the better, and I hope I can be a part of that change as we move forward with our training at University of North Dakota. But I'm hoping that we also build this whole idea around holistic medicine and recognizing that a disease process like addiction might be a part of somebody, but it does not define who they are. There's much more to us than that. So even the term medicine has different meanings. And in modern times, the word medicine really is rooted in the physical realm, isn't it? Go to the doctor to get some medicine, basically get some pills. Well, in the traditional way, the idea of medicine is more of a healing energy, and that's seen more as a metaphysical process or a spiritual process. And I really appreciated the discussion earlier, Dr. Mealy talked about the biopsychosocial spiritual approach to recovery, recognizing that in our lives, we have spirituality as a part of who we are. And we don't have to develop healing systems that deny spirituality. It's really fascinating. In my own medical training, the only time the word spirituality came up was when I was doing my hospice rotation. So we had to wait until there was an impending death before we even say the word spirituality. Well, it's very different than how we would approach things from a traditional perspective. I also have a lot of training in alternative medicine. And I've got training in acupuncture, homeopathy, and botanical medicine, and other arenas looking at things much more broad-based and holistically. And in the alternative medicine world, I've heard people say things like, we have found that the healing experience is so much more fulfilling if spirituality is included. And from a traditional Lakota perspective, that's kind of like saying, we have found that apple pie tastes better if it has apple filling in it. So I tell them, that's very wise. Well, even the provider is different, right? In modern times, another word for a doctor is physician. So we're saying right up front, we deal in the physical arena. Physician and physical have the same Latin root, physic, which means the natural sciences. In the traditional way, our provider is a healer. This is one of my favorite old photographs. This is one of my ancestors from Pine Ridge. He's a medicine man. And what we see here is very different than what we see in the clinic or the hospital, isn't it? They're outside. They're with the earth. We are of the earth. He's touching the patient. He's praying with the patient. He's meditating with the patient. And the family and the community are involved in the healing process. And for those of us who participate in healing ceremonies, the power that you feel when you know your whole community cares about you, your whole community wants you to be better, is an indescribable healing force. And we don't tap into that very well in modern medicine. And I'm sure many of you know about HIPAA, right, with healthcare privacy. So when I'm presenting this to a group of clinicians, I always acknowledge this might not be HIPAA compliant, but it is meaningful and powerful medicine. And our recovery programs need to include this. Now, one of our policy challenges, we have shown in many studies that when recovery programs for American Indians include traditional approaches, we see less recidivism, we see better outcomes. But in Medicaid plans, what we're told is that you cannot offer those services to one population. You have to offer it to everyone, right? So that's equality, but it's not equity. It's not really focusing on the needs of individual populations. And I'm hoping as this discussion moves forward, we're more intelligent about it than just assuming that if we can't offer it to everyone, we will offer it to no one. We need to be smarter about cultural and holistic approaches to recovery. Well, symbolism is very important to us as tribal nations and indigenous peoples as well. So in modern medicine, the serpent and staff, and in the traditional way, the medicine wheel. So we've all seen this symbol before, correct? The single serpent wrapped around the staff. And that's the staff of Asclepius, and that's the ancient Greek symbol for medicine. Single serpent wrapped around the staff. We've also seen this symbol too, right? With the two serpents wrapped around the staff and the wings at the top. That's a caduceus, and that's the ancient Greek symbol for traitors and thieves. Believe it or not. So somewhere along the line, someone really screwed up, didn't they? So it's prettier, it's got wings, we'll call that one medicine. So if you're watching the news and they say health alert and flash this symbol, you know the traitors and thieves must be sick. Well, this is a medicine wheel, and it's a beautiful symbol, very simple, but a lot of complexity built into it. And it shows a circle with a cross in the middle. And what it demonstrates is that things that seem opposite to each other, like east and west or north and south, are all connected by the circle. So in the limited perspective of this room, we could say east is opposite from west. We can agree. But on this earth, if I go east, and I go east, and I keep going east, eventually where am I going to wind up? Yeah. So I'm over there. I'm over there. I'm over there. I'm over there, and I'm right here. The way we use this symbolism to understand health is looking at the balance among four forces: spiritual, mental, physical, and emotional. And I know that Dr. Mealy talked about Dr. Engel, who developed the Biopsychosocial model in 1977. This was developed a long time before 1977. It's actually thousands of years old to look at bio, physical, psycho, mental, social, emotional. So we're talking about bio, psycho, social, spiritual. What we're talking about is traditional medicine. We need to acknowledge that. And when we think about traditional healing and traditional medicine, we have to recognize that we have a lot to learn from indigenous cultures. We have a lot to learn from each other across populations. And one size does not fit all when we're talking about healing and recovery. So in terms of diagnosis and treatment, we would include prayer in the spiritual realm, meditation in the mental realm, herbs and natural remedies in the physical realm, and counseling in the emotional realm. What a wonderful model to address recovery as we're thinking about recovery reinvented. Well, unfortunately, the history for American Indian populations has been very challenging. I love this quote from Euripides. He was a Greek writer in the 5th century BC. He said, "What greater grief than the loss of one's native land? What greater grief than the loss of one's native land?" And we certainly don't have time to go into the entire history, but suffice to say, we've suffered a lot of loss as indigenous peoples. We have a lot of grieving for what is lost. And I see a grieving process. I see denial. I see anger. I see bargaining. I see depression. And I see a lot of self-medication. And I think one of the challenges is that we don't acknowledge the truth of history. And the history can be very difficult to think about, difficult to talk about, but it is the truth of our history collectively as Americans. And I hope that as we move forward, we're strong enough to tell the truth about history, because if we are ever to get to equity, we have to walk through truth, even when it's unpleasant. So how does this apply to addiction? You know, in the traditional way, we look at our value system as being in the spiritual realm. We make our decisions in the mental realm, implement decisions in the physical realm, and then the actions produce reactions in the emotional realm. So even if we're not aware of the symbolism, we're constantly cycling around this medicine wheel, interpreting our values into decisions, implementing into actions, developing reactions, and then reevaluating what we are doing. Well, what happens when we take away traditional values? What happens when we take away traditional language and culture? What I see is a lot of negative emotions. Again, this grieving process of anger and depression, and a lot of self-medication. Is there a pill that's going to fix this? Is this going to be resolved in the medical model? Can I write a prescription to fix this imbalance? The truth is, what we need in recovery is a spiritual healing process, right? And that's why even our 12-step programs include spirituality. And that is traditional medicine. And in our old way, when we were honoring someone, we would give them a blanket. And of course, here in the Northern Plains, it's very important. We didn't have furnaces in the old days, right? So a very sacred and meaningful gift was a blanket. Look at that word recovery. What's it rooted in? And cover, right? To cover, to protect, to nurture. And what we've seen in many populations is that protection has been stripped away. So when we need to recover, what we're talking about is traditional medicine. Let's collectively look at this as a recovery process. And while we're reinventing recovery, maybe we should be remembering recovery as part of what we all did as traditional peoples. Let's reinvent, but let's also remember what recovery really is to Lakota people. I always like to end with a quote from Black Elk. He was a Lakota spiritual leader from the late 1800s. And again, we did not have a written language, but he met with a writer in the early 1900s, and they wrote the book Black Elk Speaks. This is my favorite quote from him. "Of course, it was not I who cured. It was the power from the outer world, and the visions and ceremonies had only made me like a hole through which the power could come to the two-leggeds. If I thought that I was doing it myself, the hole would close up and no power could come through." And what he's talking about is humility, understanding that we don't own the healing power. We're just accessing it and trying to channel it in the right directions. And if we're intelligent about this, we have to recognize that we have to channel that healing energy in different ways for different people, for different populations. We have to be intelligent enough to do that. And the core value in humility is focusing on the fact that this is about healing populations. It's about healing the communities. Now, it might not surprise you that the core value at Stanford Medical School was not humility. It might not be too surprising. But do patients ever say things like, "My doctor didn't know enough biochemistry"? No. But do we hear things like, "My doctor didn't listen to me. My doctor didn't spend time with me. My doctor talked down to me"? I think in the healing environment, as we're focusing on recovery, we also have to look at how we approach each other. Let's have the humility to respect one another, even if we are different. In the old ways of my people, in the old ways of your people, we respected each other. We understood that there is a world population and a world community. In recent times, we seem to have lost some of that along the way. What I'm hoping as we move forward and I think about the old ways of my people and the spiritual ways of my people and that connectedness we had amongst each other, that needs to be a part of the recovery process. Because as a community, we all have a role in promoting healing for all of us. We all have a role in preventing addiction through creating social circumstances in which everyone can live in a healthy way and have a healthy future. And let us remember that we all drink from the same stream of consciousness. We are all connected by that same stream of consciousness. We are all related. What we do to each other, we do to ourselves. Act kindly toward my people, for indeed my people are your people. Hao, pilami ayelo, mitakuye oyasi. Thank you all very much.